folks, let's go ahead and get started. Thank you for joining us today. You have joined the American School Health Association for one of our monthly webinars, and we're so glad that you're here today. I just wanted to tell you a little bit about the American School Health Association before we get started. The mission of ASHA is to transform all schools into places where every student learns and thrives. And we envision healthy students who learn and achieve in safe and healthy environments, nurtured by caring adults functioning within coordinated school and community support systems. A couple of benefits of being a member of ASHA. One is our Journal of School Health, which is our peer-reviewed professional journal. It's available in print and online, and you can only receive that as a member. We also have a wealth of information and expertise that you can access through our annual conference, our biweekly newsletter, and networking communities. We also offer free continuing education credits to our members. We also have a career center, and we offer discounts for job postings within that career center. We also have a free section for internships. And then we also have a variety of discounts, including a discount on American Academy of Pediatrics publications for members. I just want you all to take a moment to save the date for our 2020 conference, which will be in Albuquerque, New Mexico, September 30th through October 2nd. And that will be right before the infamous balloon fiesta. So please mark your calendar. There'll be a lot of wonderful opportunities to interact, network, and learn from others. So I want to take a moment to introduce you to today's presenter, Dr. Leanne Halbert. Let me tell you a little bit about Dr. Halbert. Dr. Halbert is a nurse with more than 20 years professional nursing experience, and prior to her nursing career, Dr. Halbert was a practicing attorney. She has New Jersey certifications, both as a school nurse and a supervisor. She's also a nationally certified school nurse. Dr. Halbert conducted original research into the supervision of school nurses in New Jersey for her doctorate in educational leadership. Her clinical background includes advanced practice nursing as a certified nurse midwife. She presently teaches undergraduate nursing in the BSN program at the University of South Carolina, Beaufort. So welcome, Dr. Halbert. Thank you so much for sharing your expertise today, and I'll turn it over to you.
Thank you very much. I appreciate that. And I'm going to just bring up my PowerPoint. There we go. So again, thank you for letting me join you here. This is the culmination, the presentation of my original research, which really speaks to school nurses and their supervisors. So we'll just go through things. Get this, there we go. So this is just my disclosure. There's no financial conflict, nobody has paid me to do this, and nothing like that. So what I'd like to get out of this, what I'm hoping that everybody attending this can get out of this, is that you will be able to relate your supervisor's background to the educational and health needs and health issues of the students whom you serve. That you will be able to identify at least 2 routes to becoming a supervisor of school nurses. And that will come out. It's kind of an interesting thing what came out in the research, although I wasn't quite too surprised, that you will be able to state at least 3 impacts of the professional background, that the professional background has on the clinical practice of the school nurse. So the supervisor's professional background, how can it affect your school nursing daily practice? And then identify at least 2 actions that the nurse can take to address language gaps between the school nurses and the supervisors. So that very bottom objective, talking about the language gap, that speaks to the, I guess that answers the question, and you could say we could end this right here, which is, do we speak the same language? And clearly, if I'm saying that there are language gaps, the research bore out that we do not speak the same language, that school nurses and nursing supervisors really don't have the same understandings of the school nurse job. So as school nurses, you all know what some of the health needs are of the students, and I'll just highlight some of them, that they're, the chronic health conditions that you're dealing with on a daily basis: asthma, diabetes, other mental, mental emotional health issues, other chronic conditions. I mean, there are some children in the schools who are so seriously ill. I'm sure there are school nurses out there who have students who have a condition that requires a DNR for them, a do not resuscitate, things like that. On a daily basis, there are children who have medication administered for PRN or as needed basis, as well as some who are scheduled. There are, I just want to check and make sure that there's, okay, there we go. That you are supporting students who are, unfortunately and sadly, are victims of violence, whether in the home, or children who are victims of sex trafficking. I mean, there are all sorts of horrible things that we know our children face. And then one of the biggest things that we know is that the school nurse is the most frequent contact that these children have with a healthcare provider. For many families, the school nurse is the one and only consistent and available contact that parents can have for healthcare for their children. So let's talk about the differences in how school nurses and their supervisors might perceive supervision to be. As you'll see in the research, most of the supervisors come from an educational background, not from a nursing background. So for the educators, it's really about pedagogy. It's about teaching children. It's about making sure that children have uptake of the information that they're supposed to get every day. How are they achieving on those standardized tests? How does that school district compare to other school districts in the state? So that's the ways that children learn. There are different ways that they learn, versus the supervision of clinical nursing practice. And that's the care of the patient. And that is, what does the school nurse see as the needs of the patient in front of them? So you can see right from the beginning the differences from an educational standpoint, which is about teaching and learning, the requirements, the different levels that the children must attain, versus clinical nursing practice, the actual care of the children. We're seeing right at the outset a difference. And the reason that there is a significance to this, there's a significance of the relationship between the subordinate and the supervisor in terms of nursing practice. That speaks to the commitment that the subordinate has to the institution. So if the subordinate, in this case the school nurse, feels that the supervisor is providing good, appropriate supervision, then there's a stronger commitment to that institution, whether it is the school or another health agency. But also, we know that a supervisor, a nursing supervisor, can help improve the skills of a nurse. And just to put this together, and this kind of follows up a conversation I had with my husband this morning, that it is, you're alone there as the school nurse. For some of you, you are the only nurse out there in a school of 2,000 students, or maybe you're the only nurse traveling between 5 schools and you've got 1,000 students spread out over these 5 schools. Whatever it might be, you are the only healthcare professional that those students and those faculty and other staff have. There's no nurse next to you whom you can ask a question of. There are no attendings and residents as there would be in a hospital setting. So you need that supervision so that, for somebody to help improve your skills as a nurse. We also know that good nursing supervision, for the subordinate nurse, can help improve the nurse's emotional state. And then what you bring to the office in terms of your emotions can really affect how you complete your job. And finally, we know that the relationship between the subordinate nurse and the supervising nurse can affect the nurse's ability to complete those nursing tasks. And that is actually what came out of this research. So one of the things that I was looking at was the research based on organizational role theory. And organizational role theory looks at the dynamics, looks at this interplay of issues within the organization, personal issues of that employee, and professional expectations. How is that employee expected to perform his or her job? So just looking at this, if you know that a supervisor can either support you or make it in a non-supportive environment, well, we know that there are going to be organizational issues that might be impacted. There might be some personal issues. Remember, we talked a moment ago about it can affect the ability, the nurses' emotional state, coming to work, personal issues they're bringing, and then the expectations, the professional expectations to perform work. And that's where we get into this question, this divide of what is a supervisor's expectation of how that nurse is supposed to perform the job. So if the school nurse role is defined by NASN, the National Association of School Nurses, as this specialized practice of nursing for students' health, it includes care coordination, and we know it's at that intersection of healthcare and education, includes advocacy, includes the ability for collaboration. And then one thing I want you to see here is that it's evidence-based. And we know that all nursing should be evidence-based in this day and age. So if school nursing gives us all of that, we need to make sure that our supervisors are able to support that school nurse role. So to this end, I conducted a survey at the end of 2016. It was, I believe it was in November, December of 2016, when I conducted a survey of the New Jersey certified school nurses. So just so you understand, New Jersey has a very high requirement in terms of educational preparation for school nurses. They have a post-bac requirement that leads to state certification. I used that so that I knew that all of the school nurses who were eligible to respond to this survey would have the same academic and professional preparation. Using the New Jersey Department of Education information, I sent out 1,822 links. You can see several of them came back, but 835 of them were opened, 712 of them were started, and ultimately 557 surveys were completed. That is a huge number of surveys that actually were completed, because of that 1,822 that I sent out, not only did I not know how many were valid addresses, because that came directly from the Department of Ed website, I didn't know how many of those nurses were currently in those schools. So although only 58 were invalid, that doesn't mean that the remaining number of surveys were actually current nurses. For example, in that list, sadly, one of the nurses I had gone to school nurse certification, the program with, had passed away. So I knew the list wasn't valid, but I had to use what was publicly available from the New Jersey DOE. So based on this, of the valid email addresses, but again, I don't know that they were correct and accurate with then current nurses, I had a 32% response rate. And of the ones that were actually opened, I had a 69% completion rate. And just to give you some background on the importance of that, Survey Gizmo points out that a typical response rate for an internal survey is 30 to 40%. That means within a business, within a specific place where somebody knows that they've got to respond to this, maybe it's coming from a boss. And for an external survey, just going out into the general public, it's about 10 to 15%. So either way, my numbers at a minimum are smack dab in the middle if we consider this an internal survey, or they far exceed what you would expect for an external survey. So I looked at two specific research questions. How do the school nurses' understandings of their roles affect their clinical practice? And then how does the nursing supervisor's professional and educational background relate to how the nurse provides those services in the school setting? And what I was trying to get at with this was, with the first one, was there any role confusion? If the supervisor, depending on what his or her educational background was to become a supervisor, if they had different expectations based on their understanding of the nurse's role, what did that mean for the school nurse's daily practice? And then the second one, again, spoke to that professional and educational background. How did that nurse actually perform his or her job? So these were the questions that I asked. So the first question, which, get the general research question, which was how do the school nurses' understandings of their roles affect their clinical practice? In other words, was there any role confusion? And these were the questions that specifically went to that. In other words, these survey questions, these 7 survey questions were put out to the nursing supervisors. Do they have enough time to complete work? Have they had situations when nursing needs and educational requirements conflict? And remember, we talk about nursing having evidence-based practice. So that number 3 there, and the importance of having nursing evidence-based practice really came into times there. Number 4, incompatible guidelines, and again, policies that might be incompatible with evidence-based practice, and all sorts of things like that. Number 7, I thought was a really critical one also. We know that nurses, school nurses, are important to attend to students' support meetings, to attend to their support needs. So the supervisors had to address, did the nurses, in answering this, did they have to miss any important student support meetings? And then the second research question, which was how does the nursing supervisor's professional and educational background relate to how the nurse actually provided services? This got to what the supervisor did. My supervisor essentially tells me I should be doing things differently, different from what evidence-based practice tells us to do, or some very specific clinical things, such as my supervisor has asked me to provide non-emergency medication to a teacher on a student, to give to a student on a class trip. In New Jersey, that is prohibited by law, and that's why I picked that one. That might be different in other states, because other states, depending on your Nurse Practice Act, a supervisor might be permitted to do that, but in New Jersey, that is not permitted. And then the last one about disclosing confidential medical information. So just to give you a little breakdown of this, the overwhelming majority of the nurses who responded had more than 10 years of experience. Very few had less than 1 year. That kind of blue segment, only 16 of them did. And then they have anywhere from 1 to 5 years in red, or 6 to 10 years in green. So the results, again, were interesting, but I will say I don't think they were too surprising. And the reason this becomes important is this was the first survey that actually documented what anecdotally my peers and I knew throughout our school nursing practice. Was there a lead or head nurse? And a lead or head nurse is not somebody who has supervisory authority. It is somebody perhaps in a liaison position. So for example, when I was in the school nurse setting, and I was in the K-12 world for 10 years, I was a lead nurse in my district of, we had 23 schools, I believe it was, about 11,500 students. So was there a lead nurse so that the nurses in that district could ask questions of, or where central administration could propose questions to and sort of disseminate things that way? And then I got to the question of who actually evaluates the nurse. And in New Jersey, this is where we get into who is the supervisor, because according to New Jersey regulations, the supervisor is the one who has the authority to be able to evaluate the nurse. And as you can see, overwhelmingly, most of the people were the building administrators. They were the school principal or the vice principal. 58% of the supervisors, the nurses reported that the supervisor was a building administrator. And then we go down from there. 17% was somebody from student services. It might have been a child study team member, somebody like that. Then we get down to somebody in athletics, so maybe the head of the phys ed department or a coach, people like that. Other or not noted, I thought other was really kind of interesting. That included somebody from the computer science department. I could see an administrator coming from, a supervisor coming from the principal, the vice principal, student services, phys ed. I can see that relationship, but I admit to being a little confused about somebody from computer sciences, IT. Only 4.5% of the nurses reported having a true nursing supervisor, and I defined that as somebody in New Jersey who had a supervisory certificate. Again, when I was introduced, I held a supervisory certificate, but they also had the authority, the actual job as a nursing supervisor. When I was in my role as lead nurse, I did not have that role because we did not have a true nursing supervisor. Then we go down to 3%, 3.6% who are in central administration, maybe an assistant superintendent, somebody like that. And then curriculum department, 2.5%. And again, that one's a little confusing because that curriculum department is where curricula are developed, whether it is the health curriculum or the math curriculum or anything else. The school nurses were supervised by somebody in the curriculum department. I suppose because the health curriculum falls under that, perhaps that's why that fell there, but I found that a little confusing also. So there we go. So having a little trouble here. Okay, this one's a really key one. So in terms of the educational background of the supervisor, you can see that the nurses, 92.3% had a supervisor who is not a registered nurse. Now again, in the state of New Jersey, because of their school nurse certification, school nurses, certified school nurses must be RNs. So we have RNs now in the state of New Jersey. School nurses, 92.3% of them supervised by somebody with no registered nurse background. And 6.3%, the supervisor did have an RN background, and then 1.4% didn't. But, you know, I look at this 92.3%, and it is amazing is the word that comes to mind, because in what other nursing specialty, if we analogize this to an inpatient setting, at what point would a nurse be supervised by somebody who has no registered nurse background? And when you think of it, again, I mentioned earlier that all of you folks who are school nurses, you're out there alone. You are the, you know, you may be one or maybe two of you in a building of anywhere from 50 to a couple of thousand students and adults, and being supervised. So somebody who is supposed to remediate you when there is an issue, somebody who is supposed to provide the continuing education that you need, somebody who is supposed to evaluate how you do your job. That's being done overwhelmingly by somebody who doesn't have the same background, who may not understand what your job is all about. So when we looked at that for all of 65.5%, not only were they in a school where the supervisor had no educational background as a nurse, but they also didn't have a lead or head nurse. So when I mentioned that a lead nurse is somebody who is sort of this liaison between central admin and the individual nurses, somebody who the individual nurses, whom the nurses can go to ask a question of, somebody whom the school superintendent can go to and bounce ideas off of, 65.5% of them don't have that individual either. So now we're even more removed from providing the necessary support that the day-to-day school nurse needs. So to look at some of these questions, I just wanted to go through them briefly. This got to the question of, I have enough time to complete my work. And I only picked the questions or the responses that were false or very false. Everybody was asked if it was, 1 was very false, 2 was somewhat false, 3 was somewhat true, 4 was very true. So these nurses, you can see how many of them felt like they did not have enough time to complete their work. The nurses with more than 10 years of experience, you can see in the red, it's very false. 101 nurses plus another 54 of them. So we have 156 nurses with more than 10 years experience when the supervisor is not a nurse. those nurses were not able to complete their job. And that's compared to the 12 nurses whose supervisor is a registered nurse. So each one of these, we have the comparison of the supervisor is not a nurse to the supervisor is a nurse. And we can see how much the lack of understanding, the lack of a registered nurse background has impacted the nurse's ability in terms of her understanding, being able to complete her job. Here's another one that I've experienced situations in which a student's nursing needs and educational requirements have been in conflict. So looking at this, we see that I looked at somewhat true or very true. And you can see in nurses where the nurse has more than 10 years experience, if the supervisor is not a nurse, we have over 150 nurses saying that they have experienced situations in which the student's nursing needs and educational requirements are in conflict. And when you look at that, this 150 students out of the 500, or the 150 nurses out of 550 nurses who have responded, that's a significant number. And that's only of those nurses who have more than 10 years of experience. So think about, what does this mean for the students on a day-to-day basis? Another one, I work under educational policies and or guidelines that are incompatible with evidence-based nursing practice. So right now I teach evidence-based nursing to undergraduate nursing students. That is key. That is part of the American Association of Colleges of Nursing. This is what our nurses are supposed to be learning how to do, provide care that is evidence-based. And yet we're finding that nurses in the school setting are working under these policies that don't go together with evidence-based nursing practice. And when we get toward the end of this, you'll see that I conducted a second survey of supervisors. And it's kind of, the responses are very interesting. So if you have questions about that, I'll be getting to that in a moment. I sometimes receive an assignment and I don't have the support staff to complete it. Again, overwhelmingly, those nurses who don't have a true nursing supervisor don't have adequate resources. And this one is a very scary one. I have compromised on a rule or policy in order to carry out an assignment. Look at how many of those nurses over 10 years experience whose supervisor is not a nurse. 84 of them admit to compromising on a rule or policy. Those rules that we're talking about, your State Nurse Practice Act, that guides everything. And this is saying that either they violated their State Nurse Practice Act, or they may have violated a school nurse policy, because there should, or school health policy in their district, the policy and procedure manual. But we're seeing that nurses felt that in order to carry out an assignment, because their boss, their supervisor told them this must be done, they had to violate a regulation or policy. That can lead to some serious consequences. And I mentioned early on about nurses having to, or the benefits to students of having the nurse in the student support meetings, like 504 meetings, intervention and referral service meetings, child study teams, other types of meetings, that nurses did not feel that they could attend these meetings because that would have left the health office without a nurse. And we're seeing this, again, the 10-year nurses, that were well over 250 nurses. So almost half the nurses are saying that they could not attend the students' meetings for student support, because then they felt that, the concerns perhaps that they might have abandoned students, that they would have left the health office without somebody being covered, and they were having to make a choice between a student who needed a child study team, student support meeting, and one who might have a potential emergency situation. And again, incompatible requests here. And what this meant was that either the Nurse Practice Act, the State Board of Nursing, perhaps the scope and standards of practice for school nurses, incompatible requests from 2 or more people. Again, the people were perhaps either actual living people, maybe a principal, maybe a teacher, or it could have included if the Board of Nursing or something like that, if they gave incompatible requests. And we can see this is happening over and over again. And that my immediate supervisor directed me to complete at least part of my work in a manner that should be done differently, again, according to evidence-based practice. And we're seeing this, that this is happening over and over again, that this is true. These last couple of questions are about specific clinical issues that I said got to how the supervisor's educational background might have had an impact on direct nursing services on a day-to-day basis. This one, I was pleased to see that the numbers were not nearly as large, that the supervisor, very few nurses said that the supervisor asked them to give a non-emergency medication to a teacher for a student on a class trip. But it still was happening to 18 of the nurses that they had said that had happened. And in fact, if you look at that list, other than the one nurse who is in the greater than 10 years, in the 6 to 10, 1 to 5, and less than 1, nobody whose nurse was a supervisor had that situation. It only happened if the supervisor was not a nurse. And this confidential, I will say that supervisors seem really good about understanding confidentiality for the most part. We do have some close to 40 here in the over 10 years that they asked for confidential information. But for the most part, supervisors did seem to understand this. And then this talked about conflict experiences. What sorts of conflict experiences for those nurses who reported them, what sorts of conflict experiences did they experience? And the greatest number were usurping professional judgment. For instance, a student came to my office, had knits in their hair, which was allowed, and we know that the American Academy of Pediatrics, the CDC, everybody says it's okay for students to stay at school with knits. Well, the supervisor said, go home. Lice was a big issue. It may have been something where they directed a nurse to send a child home for another reason, or wouldn't allow a child to come back to school when the nurse had assessed the child and recognized that the child was able to be in school. And that's a big deal, because now it's not just the nurse's issue. Now we're getting into the child missing academic, educational time, and we're getting into parents who now have to take a day off of work so that they can pick up their child at school for something that they might not need to, or they have to stay home because they're being told that the child can't return to school. Or it may have been that if somebody was directed on how to do their notes, nursing notes a certain way, or if somebody came in and told them how to do something in the office, lock the office, don't lock the office, things like that. Another one that's interesting that fortunately was relatively small, that the nursing policy and procedure manual, I'm going to say that again, a school nursing policy and procedure manual was developed without any nursing input. Other people unfamiliar with nursing were creating a P&P manual to be used by nurses. And again, we see staffing being an issue, and confidentiality that we've already mentioned. And then just plain not understanding that, again in red, that the supervisor who's not a nurse doesn't understand what a school nurse does. Because I gave you that nascent definition of a school nurse before, but I suspect if I opened up, it said open up your microphones, but please don't. But if you were to chime in, what do supervisors think you do? What does the general public think that you do? What do parents think you do? I suspect that everybody would say, I put on Band-Aids, I give out ice packs, and I hold an emesis basis. And that's the extent of my job. So there is that idea that people don't understand, that supervisors don't understand, which begs the question, if they don't understand the school nurse's work and that NJCSN is New Jersey Certified School Nurse. If the supervisor doesn't understand the school nurse's work, then how can they effectively and appropriately supervise and provide that support that we talked about early on, provide proper continuing education, evaluate the nurse, making sure that if a medication was given erroneously, that nurse is properly, that first off, there's a proper assessment to determine why the medication was given incorrectly or why an incorrect medication was given, and then remediate that nurse so that that error is not repeated. And that happened. So, and it happened in a situation when I was very familiar. So it's concerning that these things happen and put students' safety at risk. One of the other things that the nurses spoke about was that if they had a conflict, how did they resolve it? And this is a scary part. When they had a conflict with the supervisor, in other words, if the supervisor told them to do something one way and they knew that evidence-based practice said to do it a different way, or if the policy and procedure manual said to do something and they knew that EBP said to do it another way, that 9 of those nurses compromised their nursing practice. That speaks about legal issues. That speaks about violation of the Nurse Practice Act. Some of them needed to elevate this to union or attorney involvement. New Jersey is a strong union state, so the public schools are all unionized there. So 9 of these nurses had to escalate this conflict to union or attorney involvement. Now, some of them, and I give these 15 nurses credit, they abided by the State Nurse Practice Act, even if they knew it was in conflict with the directive. They get gold stars because no matter what, the State Nurse Practice Act guides and directs everything. Some of them took the opportunity to inform the educator or the supervisor about how it should be done. Some of them documented the conflict, but then they couldn't change the practice because they never had an opportunity to go back and do anything about it. And then at least one left the position because of the conflict. Now, for some of them, there was an improvement in practice, but for almost 80 of them, 79 of these nurses said that there was no resolution. So how can this have an impact, or how does the supervision of the nurses affect their work and their feelings about the job? And this gets to how they feel about their job performance. They felt frustrated. They felt, whether there was frustration, if there was, a feeling of respect. Some of them just went along with it. They didn't care. It was, I'm just going to go along to get along. And then how did the supervisor affect the clinical practice? They compromised on some of their practice. They felt unsupported. They compromised. They felt that there was a compromise to the student's education. So what did this mean? In terms of role conflict, under the WISC model, the whole school, whole community, whole child, that model of care, how can that be implemented? Well, the nurses, we know that that there's an inability to complete work timely, that there seem to be these competing goals of school nurses and their educators. And we talked about this union and or attorney involvement because they also had this fear of reprisal. And there was this questionable ability to practice as a professional nurse. When they are having their work, their decisions usurped, they're having them overridden by somebody who doesn't have the knowledge base. They have the authority to supervise, but they don't have the knowledge base. That is what came out of this study. And the consequences, think about what this means to the student. There's the ability of the nurse to practice as a professional nurse, whether you're an LPN or an RN, that part's irrelevant because you're all licensed as LPNs or RNs. So what is your ability to practice under your license? And what is the job attrition? Those are potential consequences. And then what does that potentially all lead to? Risks to the health and safety of the students. And that's not even getting on to the educational, meeting or lack thereof, the educational needs of the students. So in terms of the supervisor's background, I found that there was conflict directly related to clinical practice, frustration for the school nurse, and for those who didn't resolve that conflict, Remember, I believe it was 79 of them had no resolution of the conflict. How is practice then to be improved if the nurse and the supervisor are not communicating for the betterment of the practice and so the students can benefit? So what is the potential impact of these findings? Decreased achievement for the students, decreased academic achievement and risks to their health. Parental impact. Remember, I mentioned that parents have to take off work. There's a serious financial impact. A lot of these parents are hourly wage earners. So when they have to come to school unnecessarily, you know, you want to save those school visits for the parents for when it's really needed, when it's the parent-teacher conference, when a child genuinely is sick, when it's NITS, when your school policy says the student can stay in school. That's foolish and wrong. Then we get into this, you know, a legal issue here about non-compliance with regulations. If the school is not complying with either creating or following through on a 504 plan, on an IEP, an individual education plan, or putting the nurse in a position where he or she is not able to comply with the Nurse Practice Act. Think about what that matters. And again, we talked about inability to improve nursing practice. And then for the community, if the nurses aren't able to provide all the necessary supports and information so that students get the immunizations that they need, if they're being overridden and told to allow the students in school, even though they might not have all of their immunizations, or if that can put the health of the community at risk. So for policy implications, we need to know that the nurse has to be able to provide care within his or her scope of the license. And again, this was with an RN licenses, but for those of you with LPN licenses, same thing. And we know that school nursing should be there to support academic achievement, and that, keep in mind, the beneficiaries of the education, the beneficiaries of the school nursing practice are children. And they sometimes have they don't have a voice in policy development, and they just may not even have that voice in speaking up if they're feeling a problem, if there's a concern, if they're not being allowed to do something, or they are being forced into doing something that isn't right. So we need to have nurses more involved with health policy development and to be able to communicate with their supervisors without fear of reprisal and to get the proper professional growth that they need. So what do we do as nurses? First off, take responsibility for all of your nursing actions. Those nurses who went against the directive and did what they needed to do according to the Nurse Practice Act, kudos. And then respectfully discuss conflicts with the supervisor. Use it as a teaching moment for them. They just may not know. So it's hard. I admit it's very hard going to your supervisor. There are time constraints. There are staffing constraints. But you have to get to your supervisor and document it. And you know from nursing, you don't want to put it in an emotional state. Just Principal Smith directed me to administer medication according to nursing regulation or according to the student's medication administration order or whatever, not permitted. Whatever it is, documented as required. Most important for the nurse, read and understand your Nurse Practice Act. If you work outside of that, if you're following directives that are outside of that, you have just stepped way outside the box, and there's no protection without that. On the other hand, remember that school supervisors, they really do have the best interests of the students in mind. So their lack of or their conflicting directives are not about not wanting to give students the best possible opportunities in education. They just may not know. Use evidence-based practice when possible, and make sure that you discuss issues with your supervisor whenever possible. And for the supervisor, again, they need to know that school nurses want to support the students most effectively. If possible, we want to make sure that that supervisor has an RN background if possible. And importantly, we need the supervisors to provide meaningful evaluations and proper continuing education. So I just wanted to get really quickly to the supervisor survey. What's most striking about this is I did the same thing. Sent out to the New Jersey Department of Education, list 1,252 links. 30 people responded to that survey. That's less than 0.03%. Again, to be fair, of those 1,252, I don't know if some of them were not valid email addresses, but that's a pretty insignificant number for the responses. But most of these, 90%, were a school administrator, a principal, somebody like that. 4 of them were RNs. So, it may be that they had an interest in this. And you can see that one of them was honest and reported that he or she or they did not understand the school nurse role completely, and I suspect that's the same person who talked about asking the nurse to provide non-emergency medication to a teacher on a class trip. And you can see that that person, I suspect, also was the one who said that the educational policies and evidence-based practice of nursing might have been somewhat incongruent. But I think the most telling piece of this was the lack of response. And there were misunderstandings. For example, I asked specifically about lice because that's the one that people always seem to get hooked on, even though as nurses we know that lice is not a health issue. It is it's a nuisance. It's all it is. It's just a nuisance. But I asked specifically about that, and there were a lot of misunderstandings about transmissions, exclusions, and screenings. So that takes me to the end of this. And if I can, and there are a couple pages worth of the references. So I'm done.
Thank you. That was wonderful. A couple of questions that came up in the chat box. Is the supervisory certificate from the school district or Department of Education?
In New Jersey, it's from the Department of Education.
Okay, terrific. Excellent. Could you talk a little bit more about the supervisor certification?
So again, this was in New Jersey where I obtained mine. It was anybody going on in New Jersey for a DOE, Department of Education supervisory certificate must be master's prepared. Gosh, it's got to be about 10 or 15 years since I earned that certificate, maybe. So I'm working from memory here, right. But it was at least 4 post-master's courses, and they were about evaluation, they were about curriculum development, and it is not specific to nursing. So it was supervision for anybody in the school setting. So I literally could have supervised the math department, I could have supervised the science department, but I had my first certificate was in New Jersey. Again, the school nurse certificate is through the DOE, and we went through it, or we had, and actually still have, a non-instructional certificate and instructional, meaning I had the full certificate where I could teach in the classroom. So I had to come in with the knowledge of education in order to earn that supervisory certificate.
Terrific. Great. Thank you. Any other questions that folks have, please type in the chat box. We'll give you a moment. Do you have written evidence-based clinical guidelines?
Do I personally? I'm confused. Can that person clarify that, please? The school district where I worked, we had written guidelines, evidence-based at the time they were initially done. But in nursing, once something is done, it seems to stay that way forever. And when I had become lead nurse, and I will say that the lead nurse before me also, we really were trying to update the evidence-based guidelines. That was done through the nursing department. We were taking a couple of them every year and updating them to be current at whatever year we were updating them. We were lucky in my district that the nurses did participate in the creation of the policy and procedure manual and with our evidence-based guidelines. As lead nurse, I physically, literally took them to our school district physician and discussed with her the guidelines and made a case for them, or she made a case against them, and then we reconciled it that way.
Terrific. Were there any questions about management of chronic health conditions such as asthma or sensory screenings that are evidence-based?
specific, I'm going to look at my notes on it because so the questions were general questions. I gave them open-ended questions. So in terms of the array questions, very true, true, somewhat false, excuse me, very true, somewhat false, very false. Other than I have to miss specific meetings, I gave the nurses and the supervisors an opportunity to discuss anything that they had questions or wanted to talk about. The nurses talked most frequently about how the supervisors didn't understand lice issues, and the supervisors, interestingly, when I asked that lice question, they all said, I know, I defer to the nurse, or I know the guidelines, and then they started to summarize them, but they were in conflict with what the CDC says.
Gotcha. Do you have suggestions for how to build a relationship with a building administrator who's not supportive of their school nurse?
On a humor sense, I think food always helps. So,
that's very serious, yes.
I'm thinking there actually may be something to it. I think in terms of trying to bring about change, it can't be about an accusation. It can't be, you don't understand this, or you're doing this wrong, or I'm going to come in and fix this. It's, I'd like to sit down. I ran across something, this particular student came to me, and I ran into a problem. How we learn in communication, it's I students, this is what I feel, this is what I've run across. So if you literally can go in with your Nurse Practice Act, NASN publishes the scope and standards of practice for school nursing. If you can go in with your Nurse Practice Act and say, I have this problem, I've been asked to give medication, but my Nurse Practice Act doesn't allow it. Something like that. So it's not an attack on the building administrator. What I also did, and it was prior to doing this study, several years before this study, our district made sure that we kept daily records, very detailed records, how many visits we had from students every single day. Were they for scheduled medication administration? Were they for PRN administration? Were they for health screenings like height, weight, vision, and so forth? How many students did I have to send out by ambulance? How many, all different clinical issues. How many child study team meetings, all of that. I compiled that into a PowerPoint that I took to the Board of Education, and I presented that to them when I had been lead nurse. I wanted them to know what our nurses were doing, and I am talking, gosh, I don't have that pulled up. I'd have to go back and look, but I'm going to say in the course of the year, it was well over 100,000 visits easily. I'm working from memory, but I want to say that. So if you can compile, keep very careful records. How many times do you have to talk to the parents? How many minutes are you talking on the phone to those parents? That's taking time out of your day. That's education. It's important, and I don't mean to say taking time out in a bad way, but administrators may not know that. So if you can take that to the administrator, and this is what I did in the course of a month, this is what I did in the course of a year. There's also research that the dollar for dollar value when teachers have to answer these questions, when a teacher has to handle a student who was cut in class, who has a cut or who has a headache, what is that value? There's really good research out there that's been done on teachers' time, secretaries' time, taking away from their other jobs and doing school nurse duties. So if you can present that to your administrator, those are hard facts. That can't be argued with.
Great recommendation.
I had someone email me a question, and one of them was, we need a 60-second elevator talk to help people understand school nursing. Any suggestions?
Ooh, nice.
That's a really good question. 60 seconds is a tall elevator, though. I'm thinking...
we could do a stairwell speech. Is that what we call it, Jeannie?
Yep.
A stairwell speech, I like that. I had not thought about one, but I will tell you that the NASN definition, going back to that, is that school nurses, that the definition of a school nurse, I'm going to pull it up because I don't want to miss any of it, that school nurses, it's a specialty of nursing in which our job is to promote student health, to promote academic achievement, we bridge the gap. We are that intersection of healthcare and education, and put it in that way. It isn't just Band-Aids and emesis bags and ice packs. Mm-hmm. I put it that way. Focusing on student achievement.
Terrific. Another question, did nursing policies and guidelines cite EBG for each document, or did you do a blanket sort of in keeping with NASN, AAP, or CDC? How was that stated?
The evidence-based guidelines in our district, I assume you're talking about?
Right.
Yes, every single policy and procedure that we had in there was directly cited to the source.
Okay, great. And do you think that supervisors sometimes give priority to the parent instead of what the student really needs because they don't want to be in conflict with the parent?
Ooh, wow, that's a great question. Yes, well, I don't know if I would say they give preference, but they may listen more to what the parent says, and yet the students, you know, when you think about it, particularly the little ones, and think about even the older ones, they go to the school nurse because they have a need. They're scared, they're not feeling well, their tummy hurts. Well, what's causing the tummy? Well, the gerbil died this morning, but they literally may not be able to articulate that, whether it's because they're so young, or maybe it's a student with special needs and they cannot articulate that. So do school nurses listen to parents more? I think it's a matter of gathering information from them, and it may be easier to hear what the parent says, but hopefully they are assessing the child who's in front of them.
Terrific. And assuming the supervisor is a non-nurse, how can they evaluate a school nurse? Is that the $60 million question? I don't know.
I'm kind of speechless right now. That is the question, because what the nurses are being evaluated on is teaching. In fact, my very first year in the last school I was in for 8 years, my supervisor was my school principal. I was in a K-5 school, and he said to me, I'm going to come watch you in class, teach a class. I taught classes, I don't know, once every 2 weeks I would teach a class.
Yeah.
I spent the overwhelming majority of my time in the office, but that's all he knew. So he could evaluate, did I give objectives? Did I assess the student? He could evaluate that, but he couldn't evaluate me. And so when I would walk into an office and the school principal, when I was a lead nurse, for example, and the school principal was in an office doing an observation, if I just coincidentally happened to be in another building, and the medication cabinet is hanging open, not because the nurse was over there doing something with it, but just because the nurse thought it was easier to leave it unlocked at that moment, that's pretty shocking. So I can't answer that question. It's really scary when we're leaving narcotics unlocked. I mentioned already the medication errors. Scary.
Yeah. Well, Dr. Halpert, I am so thankful for your time and for your expertise, and I am very happy to have had you participate with us today. And I just want to remind folks that continuing education is available for this webinar. Not only do we have CHES and MCHES if you're a health educator, but we also have CNEs available. And we also have a participation certificate if you have a different entity that you'd like to submit your CEs to. Members receive free continuing education credits, another member benefit, and non-members may purchase your CEs for $20 per hour or $10 for the participation certificate. And you can obtain your CEs by completing the webinar evaluation that Caitlin just put in the chat box. So you can just click that, complete that very quickly, and we'll get that going for you.
And I will add too that it will get emailed out to participants as well if you don't have time to do it at the moment.
Terrific. Thank you, Caitlin. I wanted to let all of you know to spread the word that ASHA's 2020 call for webinars is open for submissions. We are looking for wonderful presenters like Dr. Halbert today, to submit their ideas and their proposals, and those will be reviewed by ASHA members. And we'll have a whole slate of monthly webinars for 2020, so please keep an eye open for that. And again, please save the date for Albuquerque ASHA 2020, September 30th through October 2nd. We are so thankful for you all participating with us today. We hope you found it useful, and thank you again, Dr. Halbert, for your wonderful time and expertise.
Thank you.
Have a wonderful day.
I appreciate it.
Thank you. Bye all.